Chronic Hand Hygiene. Hi, my name is Eleni. I'm going to be the nurse doing your head to toe assessment today. Can I have you verify your name and date of birth for me?
Charlie O'Brien, 4/14/2001.
Again, I'm going to be assessing the patient's mood, speech, appearance, and body build. I'm going to ask you some questions about your skin. Have you had any past skin conditions? Have you noticed any changes of any moles or anything? Have you noticed any itchy skin or hair loss or anything? No. Okay. I'm going to be assessing your skin first. For your temperature, temperature's normal. Moisture is normal. Texture is smooth. Turgor is good with good elasticity. Okay. I'm going to be testing your mental status first. Can I have you say your name and date of birth again?
Charlie O'Brien, 4/14/2001.
Okay. And do you know where you're at right now?
At my home,
Okay. And do you know what year it is?
2024.
Okay. First, I'm going to be starting with your heart, and I'm going to ask you a few questions first. Have you noticed any tightness in your chest recently? Any shortness of breath? Do you sleep with, how many pillows do you sleep with that night?
Just one.
Okay. Do you get up in the middle of the night to urinate? Do you have a personal history of heart disease? Do you have a family history of heart disease?
No.
No. Okay. First thing I'm going to do is check your jugular vein for JVD, jugular vein distension. None noted. I'm going to palpate your carotid artery. Okay. Okay. And now I'm going to auscultate your carotid artery with the bell of my stethoscope. I'm going to have you hold your breath when I say so, okay? And I'll let you know when you can breathe again. Hold your breath. Okay, you can breathe. Hold your breath. Okay, you can breathe. No bruits heard. Now I'm going to calculate your apical heart rate. I would count for 60 seconds to get the apical heart rate. Okay. Now I'm going to auscultate all 5 areas of your heart. That's all done. Now I'm going to move on to your respiratory assessment. Have you had any shortness of breath recently? No. Have you had a cough recently? Do you smoke or vape?
Nope.
Okay. And do you have a history of upper or lower respiratory infections? No? Okay. First, I'm going to be assessing the patient's chest by looking at the symmetry on the shoulders for lesions, bulging or contractions, and symmetry. First, what I'm going to do is I'm going to palpate for crepitus. Let me know if there's any tenderness. Any tenderness? No. No crepitus is noted. Now I am going to test his tactile thermitis. I want you to say 99 every time I put my hands down.
99, 99, 99, 99, 99.
Okay, tactile thermitis is equal bilaterally. Now I'm going to percuss. Resonance is noted throughout the lungs. Now I'm going to auscultate your lungs, and I'm going to have you take some deep breaths when I tell you to, okay?
Okay.
Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. breath. Deep breath. Lung sounds heard throughout the body. And now I'm going to have you turn to the side so I can inspect your back. Okay. I'm going to be looking at the patient's posture, shoulder symmetry, for lesions, bulging and contraction, looking at their skin, and yes, first what I'm going to do is I'm going to palpate for any tenderness or crepitus. Let me know if there's any tenderness.
No.
No tenderness or crepitus. I'm going to test the tactile for minus, say 99 whenever I put my hands down.
99, 99, 99, 99, 99, 99.
Okay, tactile for minus is good. I'm going to need you to take a deep breath in to test your symmetry and inhalation. Posterior chest expansion is equal bilaterally on inhalation. I'm going to percuss. Resonance is heard throughout the lungs. Now I'm going to listen to your lung sounds and have you take a deep breath when I said so. Deep breath in. Deep breath in. Breath sounds heard throughout the body, and now I'm going to be calculating the patient's respiratory rate. I would be counting for 30 seconds and multiplying it by 2. I will also be looking at the patient's respiratory rhythm, and his respiratory rhythm is unlabored and effortless. Next, I'm going to be looking at your peripheral vascular system, and I'm going to be asking you a few questions. Have you noticed any swelling in your legs recently?
No.
Any change of skin color in your legs or arms? Any sores on your legs and arms that have not healed?
No.
Okay. I'm going to be looking at all your pulses first. Can I have you look at the radial pulse? Radial pulse is good. Lumbar pulse. Brachial pulse. Popliteal pulse. Take yourself some dorsal pulse. Pulses are felt throughout the body. I'm going to test your capillary refill. Cap refill is good. And now I'm going to feel your shins for any edema. No edema noted on the shins or legs. Okay, next I'm going to be doing your abdominal assessment. I'm gonna have you lay down for me. Have you had any abdominal cramping or pains lately? Any nausea or vomiting?
No.
When was your last bowel movement?
Earlier today.
And do you have a history of abdominal surgeries?
No.
Okay. Do you notice a change in appetite lately?
No.
First, what I'm going to be doing is inspecting the stomach for any lesions, symmetry. When you're looking at the contour of the patient's stomach. And first, what I'm going to do is I'm going to listen to all bowel sounds. I'm going to auscultate. Bowel sounds are heard in all 4 quadrants. Next, I'm going to percuss. Tiffany is in all 4 quadrants of the bowel. Next, I'm going to palpate lightly. Let me know if there's any tenderness.
No. No.
Okay, now I'm going to palpate deeply. Okay, no tenderness in all 4 quadrants of the body. Now I'm going to have you stand up to check your CVA tenderness. Let me know if there's any tenderness or if this hurts.
No. No.
No tenderness or anything? Okay, well, your head to toe assessment is all done.